Members, I am now going to call to order. The public hearing and Board of Managers meeting is Wednesday, April 28th, 2021. It is 5:29 p.m. Members of the public may observe and participate in the meeting by connecting to the Ring Central meeting link listed. And I will now call to order the meeting. We have a quorum present. The first item, as I said, is the public hearing. The public hearing will begin with staff's presentation of the proposed amended mandatory payment rate. At the conclusion of the presentation, we will invite comments from the public. So this is receive public comment on the proposed and amended mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2021 under the Local Healthcare Provider Participation Program, open paren LPPF, close paren, in Travis County, and how the revenue derived from those payments is to be spent as required by Texas Health and Safety Code, Section 298E.101. Katie Coburn will be presenting. Katie?
Thank you, Chair Greenberg. I'm Katie Coburn, RHP Director at Central Health, for those board members I haven't met yet. I am here tonight to talk to you about a proposed amendment to our fiscal year 2021 mandatory payment rate as part of the Local Provider Participation Fund, or LPPF. So as a reminder, the LPPF program is a financing mechanism that Central Health administers, where we assess a mandatory payment that is assessed against the net patient revenue of Travis County inpatient hospitals. That is a uniform percentage across all inpatient hospitals. The percentage is set by the boarded managers, and Central Health collects those funds and holds those funds in a fiduciary capacity separate from our general revenue. And those funds are used only for intergovernmental transfers to take advantage of federal funds available through supplemental payment programs. The use of funds is limited to legislative purposes, and Central Health collaborates with hospital representatives on how those funds are used. Back in December of 2020, this Board of Managers set our original fiscal year 21 payment rate at 1.66% of net patient revenue, bringing in about $58 million in annual payments. We mentioned at the time that we were going to expect to amend that rate, and here we are amending it. HHSC, since that initial rate setting, has released more information that that has increased the amount of money the LPPF will need to fully maximize federal funding. So the next slide, please. So again, our original rate was 1.66%. This proposed amended rate is 3.21% of net patient revenue. This rate will generate approximately $112 million annually in local funds, and which is an increase of about $54 million over the original amount. The money that we bring in for this rate will provide the local portion of payments for the final FY21 uncompensated care payment, additional UC payments previously withheld due to the CHAT lawsuit, and the first year 5 advance payment for the Comprehensive Hospital Rate Increase Program, or CHIRP. The CHIRP is a new term. This is a new Medicaid-directed payment program that is an expansion of the historical Europe program, which I've talked to you about before. And it is this program that is really driving the need for increased LPPF funds to draw down federal funds. So with that, I will conclude my remarks and open for public comment.
Thank you very much. Members of the public who wish to make comments during the public hearing must have registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. Yvonne, did anyone register to make comments for the public hearing?
Yes, Madam Chair, we have one person registered to make comments during the public hearing. I will now read the instructions for speakers for public communication. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail 60 minutes before the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and the voicemail greeting are in English and in Spanish. All speakers will be recognized by name and in the order their speaking request was received. We ask that you keep your device muted until you are called on to speak. Please introduce yourself by name before beginning your comment. Each speaker will be limited to 3 minutes, and staff will be timing each speaker and will announce when a speaker has reached their time limit. We will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. And at this point, I'd like to call on Mr. Jeronimo Rodriguez. He is with Seton. And if you, Mr. Rodriguez, if you could please,
yes, sir.
There you are. All right, I'll start the timer.
Sure. Good evening. My name is Jeronimo Rodriguez. I serve as the Chief Advocacy Officer for Ascension Seton, which provides over $250 million in charity care a year. And we are simply here to note our support for the mandatory payment rate of 3.21% and appreciate all of your service. Thank you.
Thank you very much for attending. Is there anyone else, Yvonne?
Not for the public hearing, Madam Chair. You're muted.
I'm now ready to accept a motion to close the public hearing. Manager Valadez?
I move that we close the public hearing, hearing on LPPF.
Manager Brinson?
I second.
Okay, so we have a motion by Manager Valadez, a second by Manager Brinson. All in favor? Aye.
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 Opposed, same sign. Any abstaining? Thank you. The motion passes. At this time, I will close the public hearing of the Central Health Board regarding the proposed mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2021 under the Local Healthcare Provider Participation Program. And the time is now 5:37 p.m. Okay, we will now move to public communication. Members of the public who wish to make comments during public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. Yvonne, did anyone register to make comments?
Yes, Madam Chair, we have 3 people registered and I believe they're all here.
Thank you.
And I don't need to read the guidelines again, do I?
No, it's fine.
All right, with that, I'm going to call on Mr. Richard Johnson. He is with the Dell Medical School. Mr. Johnson, would you mind unmuting your line?
Thank you. Thank you, Madam Chair, and thank you for all attendees. My name is Richard Johnson, and I'm a community health worker at Dell School of Medicine, and I'm currently focusing on people experiencing homelessness here in the area. Currently, I've been working alongside Dell School, along with community care and integral care with vaccinating the homeless. And as of the 5th of April, we had vaccinated approximately 140 people that are experiencing homeless. And on our last date of vaccination for their second vaccination, which was towards the end of March, we were able to vaccinate almost 85% of those people in the 140 people that were originally vaccinated with the first round of vaccination. The reason why I take this so seriously is because I've experienced homelessness myself. I was homeless for about 13 months and had struggles with finding healthcare and appropriate healthcare for certain medical conditions that I struggle with. I came onto this program with wanting to work with the homeless and also connecting other pieces with mental health. So I'm currently working on that as well. Currently, we also have a vaccination mobile clinic that is taking place here in Travis County with VAMOS, and it's a community collaborative amongst the University of Texas, School of Medicine, School of Social Work, School of Pharmacy, and of course, School of Nursing, just to mention a few, and other collaborates of the community. That's all I have to say for now. I thank you again for the time and for the platform.
Thank you for your public service, your tremendous work, and the 85% on the second vaccination. Congratulations. Thank you so much.
Thank you,
All
Madam
right.
Chair.
Excuse me. Our next speaker is Ms. Anais Cruz, and she's a program manager of communications and community engagement at Central Health. Anais.
Hi, thank you. Good evening, Board of Managers. As Yvonne mentioned, I'm the Communications and Engagement Program Manager with Central Health. And I'm here to share with you that Central Health will be opening up applications for the 2021 Community Health Champions Program starting this Friday, April 30th, which makes this our 6th cohort, and we are very excited. For those of you that may be unfamiliar with the program, briefly, it is a program that brings together diverse community members from across Travis County to learn about, discuss, and collaborate on the work of Central Health and our partners. That includes Sendero and Community Care. And since the program began in 2016, we have graduated over 200 community health champions, 2 of which are in our virtual room today, Manager Musaitif and Manager Matwani, 2 examples of like the ultimate community health champions. And last year, the program went completely virtual despite it being online. We actually increased our program retention rate from 88% in 2019 to 93% in 2020. So majority of our applicants actually hear about the program through word of mouth. So we're encouraging you to help us spread the word. And I plan to get together with Brianna so she can share more info with you on how you can help with recruitment efforts this year. That's it. Thank you.
Thank you so much. And thank you to our board members who have also been community health champions. Again, we appreciate your continued public service. Thank you.
Madam Chair, the last person to speak during public communication is Manager Cynthia Valdez. Manager Valdez.
Thank you. Good evening. My name is Cynthia Valadez, and I'm here to reinforce and reassure the public that Central Health is committed to their health care. There has been some concerns since the Travis County Commissioners vote last week to approve the purchase of certificates of obligation by Central Health for the purchase of some buildings and also for the clinics in Eastern Travis County. Those of which, some of the questions which were posed to me, I'm going to go ahead and recite right now, but they did come from community members, some organizations, some elected officials, and others. Why is here, number one, why is Central Health developing a headquarters during this pandemic? What is the fiscal impact to taxpayers? Is there going to be an associated tax rate hike? Is Central Health doing that? Why is Central Health doing this when their property values are being raised through the roof, which will mean increased property taxes to the public? With the 1115 waiver being terminated in Texas and Central Health no longer receiving federal dollars, what is the impact to Central Health's ability to deliver healthcare services? Will healthcare services be cut in order to allow us to build the new headquarters? Why was there no public input or forum provided for the public and taxpayers to discuss this before the action was taken to buy property in Hyde Park? Doesn't Central Health own its own building and have few employees? Also, doesn't CUC own their own building as well? As a result of these questions being posed to me, if they were posed to you, well, then you will understand the concerns. But because of this, I'm asking Central Health and I'm asking our board and our staff to conduct a community-wide forum to discuss Central Health plans for its 180,000 185,000 square foot, $85 million building, or however much it's going to ultimately cost us, to get some common understandings with the community. We should consider this forum and community input as part of our due diligence and feasibility period, and encourage the public to be involved in the decision-making process. Additionally, I think that Central Health staff needs to answer the questions to the public so that the community can understand and hear from our board of its commitment to the mission of providing healthcare to the neediest population. I can't think of a time that Central Health is at its most vulnerable state, with many financial risks facing it, including the issues and questions about who is serving our indigent population with hospital services. I know we are. How is Central Health taking advantage of the ACA marketplace expansion through the Biden stimulus package, the American Rescue Plan, and now the Family Act to increase access for the over 175,000 uninsured in Travis County who are not members of the ACA and don't have a comprehensive health care plan?
Excuse
And
me,
how
Manager
Central
Valdez.
Health can lead the health equity and hesitancy issue. Thank you for your time, and I just would like for you as a board to consider these concerns by the public. Thank you.
Thank you, Manager Valdez. And I know that we have addressed these concerns a couple of times. I'm sure that Mr. Giesland has information that he can send out again, because it is very important. And of course, our top priority, as you know, is the clinics in the Eastern Crescent. And when the time comes for this particular item of the building to have input, rest assured, as we have stated, we will be seeking input from the community. So thank you very much, Manager Valdez.
You're welcome. Thank you.
Madam Chair, this concludes the public communication portion of the meeting. Thank you.
Thank you very much. So we will now proceed to the regular agenda, the consent agenda. Item C1, receive and ratify Central Health investments for March 2021. Item C2, approve the minutes of the Central Health Board of Managers March 31st, 2021 meeting. Item number C3, approve the appointment of Amit Motwani to the Sendero Health Plans Board of Directors as recommended by the Executive Committee for an unexpired term to end October 31st, 2021. Do we have a motion?
Chair,
Yes.
I move that the board approve consent agenda items C1 through C3.
Is there a second? Manager Valdez. So we have a motion by Manager Bell, second by Manager Valdez. All in favor? Aye.
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 Opposed? Same sign. Any abstaining? Thank you. The motion passes. We'll now move to our regular agenda. Discuss and members and managers, in order to accommodate some presenters' needs as far as scheduling, we will be taking the agenda slightly out of order this evening. Item 8, which is the HAM item, will be taken up before all of the closed session items. Thus, the new order will be 1 through 6 and 8, then 7 and 9 through 11 in closed session. So we will move to the regular agenda now. Item number 1, discuss and take appropriate action on the proposed amended mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2021 under the Local Healthcare Provider Participation Program, open paren LPPF, close paren, in Travis County as required by Texas Health and Safety Code, section 298E.151. Katie Coburn will be presenting. Katie, please.
Thank you, Chair. I don't have further comments to add from my presentation at during the public hearing.
Okay.
So any questions I'm happy to take.
Manager Valadez.
I'd like to make a motion.
Okay, thank you.
I'd like to move that the Central Health Board of Managers amend the mandatory payment rate to be assessed on these healthcare providers to 3.21% of the net patient revenues.
Is there a second? Manager Brinson? Okay. Are you seconding?
Yes.
Okay, so we have a motion by Manager Valdez, a second by Manager Brinson. All in favor? Aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, managers. The motion passes. Item number 2, receive a report on fiscal year-to-date healthcare service expenditures made by and accept preliminary March 2021 financial statements for Central Health and the Community Care Collaborative, and review historical average revenues and expenses for Central Health. Presenting this evening will be Lisa Owens and Patty Bethke. Welcome, Patty, and we'll let you two take it away.
Okay, just checking that you can see my slides. You can see? Okay, great.
Yeah.
And Patty, you're still on mute. Welcome, Patty.
Sorry, I'm having a couple of issues. My Bluetooth has disappeared from my computer, so sorry about that. Thank you, Chair Greenberg, for recognizing me. Good evening to the Board of Managers. I'm Patty Bethke. I'm the Controller for Central Health, and I'm happy to be here today to present the Central Health financials to you. I'm just going to hit the highlights of the financial presentation rather than go through all the detailed slides. The financials were shared with you in the packet, and staff is available if you have specific questions as you go through them. Hopefully you've had the chance to review the packet, and I'm happy to answer any questions if I can, or I can take them back and get back to you. So here are the highlights that I'll go through. You'll notice that the significant transactions this month are on the balance sheet. On slide 4, the assets, there we go. The asset shows we continue to have a strong cash position with our current assets at $372 million. Restricted funds for capital acquisition of $11.6 million reflects an increase for the board-approved Red River project. And we have total capital assets of $62.7 million, and it is reflective of the Brackenridge Hospital Tower impairment write-down totaling $51 million due to the redevelopment of the property. And as Lisa mentioned last month, this change does not affect our cash position. On slide 5, for liability and equity, we continue to have relatively low liabilities at $15 million. And I do want to point out a change in debt services impacting short and long-term debt related to the annual debt payment of $1.2 million made on March 1st. This reduces our total debt from $7.3 million in February to $6.1 million in March. Our total net assets have increased $65 million year over year and includes the Brackenridge Hospital impairment totaling $51 million. This is down from the prior month's year over year change of $110 million due to the Brackenridge impairment write-down. Moving on to slide 6, sources and uses. There are no significant transactions for this month. Property tax revenue has slowed as expected and represents 101% of the budget, with the excess, as was mentioned last month, relating to the timing of the appraisal district's preliminary valuation estimates versus the final certified roll for an additional $5.2 billion in valuations after the Central Health budget was set. We did not have any significant healthcare program or administrative program transactions, and our operations continue to be steady. With that, I will turn it over to Lisa to present the CCC financials.
Thank you.
Thank you. So let me just switch to CCC.
You're good.
So I would echo Patty in the CCC with our healthcare operations. There were no significant financial transactions, but I will hit a few highlights. We did have total assets, predominantly cash and cash equivalents, of $16.8 million as of March 31st, and liabilities of $13.5 million with total net assets of $3.3 million. The majority of our liabilities are in the healthcare delivery services, and those are shown on the sources and uses. So as you know, we do set aside revenue we've received as deferred for potential audit or review by HHSC. We update that with the great information that we get from our DSRIP team. So the recognition of DSRIP revenue just recognizes that change. However, we do get that primary source of funding in the summertime. And so just wanted to point that out. In healthcare delivery, again, operationally, we're in a very steady state, both in Central Health and the CCC, with about $6.5 million in healthcare delivery costs and about $7.4 million in the DSRIP expenditures with the providers who are delivering their programs. We are at 33% of the healthcare delivery operations costs at $8.2 million. And again, we continue to improve the estimates that we make, both in Central Health and the CCC, about the timing and recognition of utilization of services as we continue to serve patients through the service contracts in healthcare delivery. So with that, for Central Health and the CCC, we thank you. As Patty mentioned, we're available for questions.
Thank you both. Members, any questions? Manager Valadez?
Thank you. In looking at the DSRIP I guess the DSRIP revenue and expenses for the, I guess since 2014, since the inception, why does there appear to be an imbalance between DSRIP revenue and expenses consistently? And is all that money going into the CCC budget? How are we spending it? I noticed that even in what you just presented, if you can go back to that screen. Hello?
I'm coming. 1 minute.
Manager Valdez, if you'll allow me to interject, for those of you joining us by phone, if you will kindly mute your phones for the presenters and the other participants in the meeting. Thank you.
Okay, so explain to me, with the revenues that we get from the feds coming back, based on the money that we send up, completion of our DSRIP projects, the success and the outcomes, then we get back the federal dollars. Those federal dollars are then what? Are they put in our budget? And if so, should all that money go into our budget, and how is it spent? Because if you look at the total, let's first answer that for me.
The CCC receives DSRIP revenue.
Right.
In the summer. And there's only one transaction now that used to be more frequent, but there will be a summer revenue for the CCC.
Right. It's just that the healthcare delivery is a budgeted amount, let's say for the programs this year, let's say looking at this year, it says budgeted amount was 61 million for revenue, basically 61.2. And the healthcare delivery of that's 61.2. Well, I can see that. But for healthcare delivery, we're only spending about $20 million in healthcare services delivery. Is that 35 million coming directly out of DSRIP?
So the uses of funds are healthcare delivery through service contracts, the UT services agreement, and then the DSRIP projects actually have healthcare delivery expenses through performing providers.
Okay.
Those are the three uses of funds.
Okay, and so we did get, I guess, final. No one has contended the fact that we're spending DSRIP revenues on the medical school $35 million contract, correct?
Manager Valdez, if you'll allow me to answer, this has been a part of the community care collaborative budget. And I'll defer to others about, since when, but this is how that payment to the med school is funded. The only other comment that I wanted to make, in addition to what Lisa had responded with, is that with the DSRIP projects, you're at risk, and so there's a cash outlay, if you will, and I may not be using the correct terminology, but the revenues received are because you were able to meet your performance obligations.
Right.
If you did not meet them, then obviously you're at risk of not being paid. So I just wanted to add that commentary as well. Thank
Right,
you.
but if what I recall over these last few years, there's only been one project that we did not really perform the way we thought we were. Correct? And wasn't that having to do with teenage pregnancies?
Manager Valdez, I don't recall right off the top of my head, but I think there's some others on the line that have much more in-depth knowledge on the district projects and could answer your question.
Okay.
Is there someone who can respond to that?
Manager Greenberg.
Yes.
So Manager Valdez, I'm happy to research your questions and
Yes,
get
John.
back with you.
John
I don't, I'm sorry?
This is John Morgan, right?
Yes, ma'am.
Yeah.
I don't have as much of the historical context that I think you were just referencing around prior projects. As a reminder, this most recent round of the DSRIP program is performance improvement on clinical metrics. And I'm happy to provide an update as the board sees appropriate on the CCC's performance of those DSRIP programs this year that are, again, based on performance improvement on different clinical measures.
I appreciate that, Jonathan. You know, when we first entered into this DSRIP route, one of the things that we were told as a board is that the results or the outcomes of the DSRIP projects would be incorporated into the practices and protocols of how we provide healthcare delivery here in Central Health. And I have asked in the past whether or not, you know, how has that actually occurred? How have the results been incorporated into how our healthcare delivery services, you know, has basically been improved by these outcomes? And I don't believe I've ever gotten a clear answer on that. I sure would like to have one. And maybe this is an offline conversation, but I think it's an important one for us to have so that the public and we as a board can understand clearly what this is doing. If we're giving $35 million in the revenues from the feds, if we're giving $35 million to the UT Medical School, then personally, I'm one of those people, and you know this, Manager Greenberg, I'm one of those people that has wanted to know historically, what have they done for us?
Right.
What have they done for our targeted population? And I have yet to receive any of those responses. But either way, if there's some other generalized information that can be provided to us, I'd like it. Thank you.
Thank you, Andrew. I think Mr. Giesland was trying to answer some of your questions. Mr. Giesland?
Yes, John, if you'll permit me to interject here, and then I'll turn the floor back over, subject to the call of the chair. But Manager Valdez, we agree, and that's why we bring back very detailed district reporting year over year on what those outcomes have been and the successes and also the lessons learned. And that's a report that's brought back to the board. I don't, again, have it off the top of my head about what the time frame for that is. But also, I think your question is certainly appropriate, because as DSRIP draws to an end, having that final reckoning, you know, looking back and answering that very question, okay, now that we've had multiple years and we had the infrastructure, you know, phase one, and then what part two is now really working towards the outcomes, what is it that has been incorporated into the healthcare systems? And I think certainly as we proceed with our systems based through equity lens planning, to fill healthcare gaps, you know, bringing those two conversations together at the same intersection is a great conversation that the board and the public should have.
Thank you.
We have to have that. Thank you.
Thank you, Manager Valdez, and thank you, Mr. Giesland. I certainly concur. And let's, John, if you could, and Mike Giesland, pull up perhaps some of those detailed reports. I do recall us receiving them. So, but you know, a lot has happened over the past year, right? And so let's refresh those and some of those outcomes. And if there was one project, but yes, Manager Valdez, the whole idea was that we would the state had this waiver that we would pilot basically concepts and kind of front the money. And then if we meet the metrics, get reimbursed, and it was a way to pilot. So thank you very much. All right, we'll look forward to more information on that.
Thank you.
Okay, so is there anything else, members? There's no action necessary on this item. If not, we will move on to item number 3 on our agenda. Okay, item number 3, receive and discuss a presentation on the fiscal year 2022 budget and the financial forecast for subsequent fiscal years, which presentation will include information on possible property tax rates to be assessed. Jeff Canoto, Lisa Owens, and Lester Hanaher, and welcome Lester, will be presenting. And again, no motion will be necessary on this item either, members.
Thank you, Chair Greenberg. Jeff Canoto, CFO, and Lisa and Lester will be joining the presentation shortly. So this is our initial step related to the fiscal year 22 budget. It's our initial presentation. It's a real high-level presentation. If you can go to the next slide, please. Excuse me. This kicks off our upcoming fiscal year 22 budget process, although internally staff is working through departmental budgets and business cases. So we've started probably a couple months ago, and we will be coming back in June for the initial proposed budget. So this is an initial tool that starts the process. It helps give us assistance to develop future estimates, to identify revenue, expenditure trends that could have an influence over the time period that we're covering. In this case, it's a 7-year period, and to help us develop any policies, objectives, known events that could occur. It also helps us improve our decision-making in the budget process to be able to provide an adequate amount of time to plan for any known upcoming events and to maintain financial reserves for any unknown events or risk. Quote, things that we don't know, we know. Next slide. So, as I mentioned, this is a 7-year forecast. The financial forecast tonight, again, will help us assist us with financial planning of those risks and help us smooth out any known events, help us mitigate financial volatility. And so what that really means is if you see a large event coming in the future, you have time to plan for it, and you don't have to respond to it quickly. You can plan for it so that you're not at risk of either a significant increase in taxes, the property tax rates, or potentially a cut in services, reduction in services related to that. So this is a real valuable tool that lets us look out over a period of time. And quite frankly, it allows us to look out over that time and focus on what we call structural balance. So there will be times where our reserves will be higher. There'll be times where our reserves might be lower, but overall, over a longer period of time, we don't have unknown peaks and valleys that we have to react to quickly. It also allows us to evaluate reserve levels and financial metrics related to our healthcare strategies, and also helps us maintain a strong bond rating related to how we're organizationally evaluated by the bond market. And then last, it establishes an initial property tax rate to prepare the proposed budget. And I just want to reiterate that there are a lot of opportunities as we begin the budget process to make changes. This, again, is an initial process and does not in any way limit the board's ability to make changes throughout the whole budget cycle. And Lisa will be going over that cycle at the end of this presentation, some of the scheduling. Next slide. So with any long-term financial forecast, it's pertinent to look at what type of financial risk are out there. I've listed a few, but to be perfectly clear, this isn't all the risks that are out there, and these are just a few to be cognizant of. One of those is a transition to a direct payment model for services. Central Health is currently in an indirect payment model for hospital services. Although an indirect model contains certain risk, transitioning to a direct payment model places more risk related to overall service utilization and also future changes in how healthcare is delivered. And quite frankly, over time, advancements to treatment of both patients and chronic illnesses as healthcare improves, as advances in sciences are made. There are all sorts of inherent risk, financial risk related to that, in addition to just the ordinary risk of typical medical inflation, et cetera, et cetera. And then secondly, related to just payment for services, we've been through a pandemic. We don't know, we think we're coming out of it. We don't know what the future holds, but certainly we've seen that any pandemic changes out how healthcare is delivered. And so that's certainly an ongoing risk over time. Secondly, regulatory risk, listed HIPAA and privacy, just related to those areas. There are large penalties and fines associated with these areas. And certainly we at Central Health feel like we are adequately insured. But again, in the event that any occurrences occur, that certainly any coverage increases would be substantial. And then uncertainty of future supplemental program funding. We actually thought there was some certainty related to the latest approval of the 1115 waiver that was recently rescinded. And it's not as much the context of the program that was approved. It's mainly just the uncertainty of what are there going to be significant changes in the future related to the supplemental programs. And over the last 3 or 4 years, I think everyone could agree we've seen substantial changes to how healthcare services are funded, in particular how the local funds are provided for some of those programs. And then thirdly, related around around Sendero, there's a lot of volatility in the insurance area. Future-based capital requirements, those are really predicated on future membership levels, risk adjustment scoring, and claims experience. Some of those which can be controlled, some of them which may be potentially beyond our control. And then lastly, related around the insurance industry and around Sendero is just the cash flow. As we transition to more high-risk patients. There are high costs related to services to those patients. And the way that the risk adjustment payment process is made is you go throughout the whole year. So you're providing services, you're paying claims for those patients. And then there's a reconciliation period subsequent to the end of that period, calendar year period, that generally lasts about 8 months before you actually receive payment for those high-risk patients. So there's a lot of initial cash outlay related around the care of those patients. And so that's something that we certainly want to keep an eye on also. So with that, next slide, I'll turn it over to Lester to continue the presentation.
Thanks, Jeff. And good evening, Board of Managers. I'm Lester Hanaher. I'm the budget analyst at Central Health. And I'll be discussing the assumptions that we used in determining the 7-year forecast. Next. No, this is the slide. So this slide outlines the board objectives that were considered during the preparation of the FY22 forecast and approved by the board through 2024. Next slide, please. These are our 7-year forecast assumptions. For tax revenue, Central Health received our net taxable value estimates from Travis Central Appraisal District, known as TCAD, on April 22nd. TCAD's net taxable estimates are 10.1% higher than they were in July of 2020, partially driven by a higher number of protests pending review. These estimates include new construction to come in at another record high of $6.5 billion. For our capital planning, we've built in continued progress in Del Valley and Hornsby Bend and the Colony Park clinics. Last month, the board approved the issuing of debt to fund 2 Eastern Travis County clinics in the Consolidated Administration Building. Next slide, please. For healthcare services, we estimate healthcare costs to come in at 8% year over year. We expect them to increase 8%. We've also added for capacity for infrastructure and network operations. Additionally, we've planned for continued enrollment and funding for the CHAP and ACA high-risk premium programs. For salary and benefits, we've added necessary compensation increases. We've also planned for incremental staffing growth as our services continue to expand. That wraps up the assumptions that we built in. I'm going to turn the presentation over to Lisa to talk through the charts.
Thank you. Lisa?
Thank you, Lisa Owens, Deputy CFO, and thank you, Lester. He's really pulling together all these details, so you'll be seeing a lot more of us as we kick off this process. So we have 2 models to show you tonight. Just high level, these models we have been using are consistent with previous years. It is a 7-year time frame. It does allow you to see a future point where we anticipate the structurally balanced budget that Jeff referred to. We do have 2 different tax rate increases over the maintenance and operations, no new revenue rate. However, in both models, the expenditures are consistent. So it assumes the same expenditures in the assumptions that Lester went through. And then it shows you a days of cash on hand metric based on our total reserves. So in this first model, which is consistent with what the tax rate was last year, which was 6.9% over the M&O, no new revenue rate. This does show that in 6 years, we would achieve that structurally balanced budget here where the sources and uses kind of even out. And that results in our reserves beginning to stabilize. The second model that we prepared was just 6%, which shows you that even at the 7-year mark, the sources and the uses do not come back together for that structurally balanced budget. And the result is a continued reduction year over year of the reserves. So we are planning to recommend that we move forward preparing the budget at that 6.9%. That helps us maintain that stability over the long term. As we're working on drafting the budget, I also wanted to just hit some highlights of another component, which is the homestead and over 65 and disabled exemptions. We are going to be working in the next month at looking at the over 65 and disabled. You will recall we have the highest maximum allowable by law homestead exemption at that 20%. But we do hope to analyze and maybe bring some recommendations back at the May board meeting for you about potential changes if appropriate. So with that, the next steps, this is just the first one. So welcome to our new board members. We do plan to start drafting the budget. That work is underway. And in order to have a starting point, and I just want to remind the board, this is not posted for action and we are not setting a tax rate in any way, shape, and form. We're just starting with a proposed budget. It gives us a starting point for discussion in June. And we will bring that back to you at that June 14th board meeting. We have a lot on the calendar between now and September 30th. I know we've had to make some recent changes to accommodate some necessary timelines and appropriate times when we will and won't be meeting. But the next step is really starting strategic planning, works on those strategic objectives. And remember, the budget is based on the strategic objectives for FY 2022 and that longer term goal in 2024. We will be back in May. I anticipate in May bringing a full capital budget. We will be reporting out to you year-to-date expenditures on the 3 projects that the board approved in January. As well as providing a longer term picture on what the capital reserves and capital budgeting will look like from a management perspective going forward with the different financing sources. And then we do plan at the June 14th board meeting to present the draft budget. That proposed budget will be shared widely with the community and available in advance of returning to you in August to begin the many important activities that finalize our budget, including setting our maximum tax rate and then eventually the tax rate, with our goal of presenting both the final budget and the proposed final tax rate to the Commissioners Court for their approval on September 21st. So I look forward to a great summer with all of you again. And with that, I think all of us are available for questions.
Do we have any questions at this time? Manager Musaitev.
Thank you. Thank you everyone for that presentation. Looking forward to this year as well. I know last year we went up to 6.9%. It was one of the highest years. Can we, I know the projections are you're planning on moving forward to 6.9. I'm a little more fiscal, conservative. If possible to go a little bit further down, given that the pandemic and many have other financial obligations, I would appreciate if we can consider a lower tax rate at this moment in time, given where we're at. Thank you.
Manager, other questions or comments? I'm sure that we can do a side-by-side with 2 different rates. We have done that before. And so that's something that I'm sure we can manage to compare this to a lower rate and see what that does as far as our reserves and our break even and those other financial matters. I completely understand it is difficult for many people. But I do also understand that, at times when many people are hurting the most, it is organizations such as ours, or for instance, unemployment, right, that people also need those services the most. So we have to balance that. So let's look at two different rates, but also we have to look at what that means for our financial situation and our reserves, because as Jeff Knodel says, we don't exactly know the road ahead. Manager Valadez.
Yes, I'm in agreement, Sherry. Madam Chair, complete agreement, because now is the time for us to be receiving a lot of requests for help and assistance. You know, hence my urgent request that we would have expanded our ACA outreach to our uninsured, because we have a tremendous number of uninsured out there. And I'd like to see those numbers, those investments of our dollars increase into those communities. I'd like to see different strategies implemented with different communities to be more culturally relevant and sensitive to them, especially with respect to language. And maybe if we could pull out that old sheet that talks in terms of how we at Central Health and the enterprise are investing most of our money in healthcare delivery services, not in brick and mortar, although we are doing brick and mortar because we have to, especially in our neighborhoods that are getting at least 2 clinics. And so that might be I
think that was the airplane placemat or something like that.
That's it.
But I completely concur with you. For us, spending money means that we are providing healthcare and investing in healthcare for those who need it most. So thank you. Members, anything else? I'm not seeing anything at this time, and there is no action needed on this. This is the introductory portion of what will be our budget discussions. We will be spending much quality time with staff, and we thank you. We know how hard you're working, and we'll work on this and with each other. So thank you, everyone. If there's nothing else, then we will move on to item number 4. Discuss and take appropriate action on a resolution authorizing expenditures associated with the capital line of credit authorized by the Central Health Board in November 2019 and reimbursement of Central Health funds from the line of credit proceeds. Lisa Owens will be presenting, and my understanding is this is a very technical administrative matter, right, Lisa?
Yes, managers, this is simply a procedural request to ratify and confirm the reimbursement resolution that you approved in November 2019 for Central Health to reimburse ourselves for expenses that we intend to finance using future draws on a line of credit not to exceed 10 million. And under advice from counsel, given the passage of time, we just felt it was prudent to reconfirm our intent for this activity. The resolution just allows us the ability to make sure we can go back and capture those expenses. And to date, we have not made any draws on that line of credit, but we wanted this important vehicle in place to ensure that capability.
Managers, any questions? If not, I'll entertain a motion. Anyone? Manager Bell. I think you're on mute.
Yes, I was. Sorry. I move that the board adopt the resolution as presented regarding reimbursement of the Central Health expenditures from the line of credit proceeds.
We have a motion. Is there a second? Manager Brinson?
A second.
Okay, so we have a manager and a second. All in favor say aye. Aye.
Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you. The motion passes. Thank you, members. We'll now move to item number 5, receive an update on and take appropriate action to ratify the transition of the BB&T Trust Deposit Fund to BlackRock Treasury Fund. And Jeff Knodel will be presenting. I think this is just, again, one of those administrative matters due to a transfer to a new fund. Jeff?
Right. Thank you, Chair Greenberg. Yes, it is somewhat routine, but just to give a little background information, and there was some information in the packet. the employee, and when I say employee, the enterprise employee, so it's community care, Sendero, and Central Health, retirement and deferred compensation plan administrator was purchased not too long ago. And that formerly was BB&T, was purchased by Truist. And in the transition of all of the moving the investments from BB&T to the new entity, there was a fund option that was not going to be continued in the new selection of investment options for employees. And so we had very little notice as it related to notice that wasn't going to be continued. And then we had to notify the administrator of where to put the dollars. And we did not have a board meeting in the timing wise in order to get that approved. Historically, that has been a function of the budget, finance, and or the board of managers to approve fund selections for those plans. So rather than have the money taken out, employees' money taken out of the account and not held in any investment vehicle, Mr. Giesland took action and authorized the funds in the BB&T trust deposit account to be transitioned to the BlackRock Treasury Trust Fund, which is a equivalent offering of the new administrator. And so the action that we're requesting tonight is just to ratify that action. We felt like that was the prudent action to take rather than leaving employees' investments or money contributions in their plans uninvested until we could get to the board for approval. So I'll be happy to answer any questions that the board may have.
Thank you. So this is so that the employees' funds were not sitting idle, not earning interest, or being invested. Is that correct?
That's correct.
Managers, any questions? If none, I'll entertain a motion. Manager Valdez? I think you're on mute, Manager Valdez.
I think she's telling me to make the motion.
Okay, Manager Bell, go ahead.
I move that the board ratify the action previously taken by the president and CEO authorizing the transition of the BB&T deposit fund to the BlackRock Treasury Fund.
We have a motion. Is there a second? Manager Valdez seconds. Okay, all in favor? Aye.
Aye.
Opposed, same sign. Any abstentions? Thank you, members. The motion passes.
I just have to thank Dr. Bell for lip reading well.
Yes, that was wonderful. Thank you. Thank you both. That's real teamwork. Thank you. Okay, we will now move on to agenda item number 6, receive a briefing on and discuss fiscal year FY 2021 strategic objectives per board adopted budget resolution or board directive, and receive updates on current items, including current workforce demographics and levels, including new hires and turnover, employee recruitment initiatives, hub vendor work plan, and hub vendor contracting data. Susan Willers, Sarah Willingham, Betsy Good, and Lisa Owens will be presenting, and I will turn it over to them. Thank you.
Thank you. Good evening, Board of Managers. Susan Willers, Enterprise VP of Human Resources. I am going to cover, along with Betsy Good, the dashboards. So several months ago, we changed the reporting of how we were presenting the workforce data, and we changed it into this dashboard format. We think this format is easier to view and interpret the data. After presenting the data in this format for the last 2 or 3 quarters, we are working on expanding the data that we are including in the dashboards to include other important factors of the employee's life cycle within Central Health. We hope that next quarter or in August, we come back with those enhancements, and we hope that you all will approve that they are worthwhile sharing with you every quarter. So with that, I'm going to go ahead and start the dashboard presentation. And so we have 4 dashboards. The first one is headcount demographics, and this is an overview of our headcount, not only for Central Health, but for the enterprise, and then we divide that per entity. So currently we have 1,308 employees enterprise-wide, and you can see the breakdown of the data per entity and including the gender per entity. The tenure at Central Health averages between 3 to 5 years, community care 1 to 2 years, and Sendero, it's pretty good split between 1 to 2 years and 3 to 5 years. In our generational information, this is a glimpse of just generation of our workforce. As you can see, we have a pretty young workforce, with the majority falling under Generation Y, and followed by Generation X. And just to put that in context, Generation Y are those folks that are born between the years 1981 to 1996. And Generation X are those young people like myself, born between 1965 and 1980. So let me scroll here. The second dashboard is our turnover. Again, we present this to you for the enterprise as well as by entity. And the turnover, starting here on the right-hand side where my cursor is, the turnover for the enterprise climbed 4% compared to last year during the same quarter. It is no surprise that our turnover has increased due to COVID and how it's affected our staff's lives, including our operations throughout the different entities of the enterprise. Central Health has a reduction from 11% back in 2020, same period, to this quarter, 7%. You can see Community Care's turnover has grown to 23%, and Sendero has decreased for quarter 2 2021. We also have provided the reasons right in the center of this dashboard. And I do want to say that we, Human Resources, are working to really enhance how we are sharing these termination reasons with you all. I think we, as a team, have come together to ensure that we are more clear and more reflective of the actual reasons for the termination. And so we are going to be working on bringing more concise reasons for you all. Sometimes we get a lot of questions of, well, what does management mean and what does organizational fit? And by the way, JA here in this graph means job abandonment or leave. And so it's not very clear. And so we want to come back next time we present with more clear categories for these reasons. On the community care side, just to talk about their turnover, they have done a lot of work in the last 3 months to really ensure that their compensation is in line and where it needs to be for their frontline personnel. And they've also done quite a bit on the educational front with on their clinical side. They've got an education department. And so Jeannie Burden, the VP of Human Resources, along with Amber, her manager of education, have been working on just enhancing their training opportunities. So I think we'll be seeing a big change in their turnover this coming quarter. And then the last thing in this dashboard is the tenure of voluntary turnover. And so you can see that the maroon piece is the enterprise and the blue is Central Health proper. And 0 to 6 months, we have a 32% turnover of those that left the organization within this quarter. And I just want to add that although some of the turnover has come from one of our entities, it really has been extremely challenging during the COVID period. And Sarah's going to talk a little bit more about some rapid hiring that has taken place at Community Care recently. They're doing a fantastic job in trying to staff those COVID units and vaccine clinics. And so we're working with them, but I do think that with everything that they're doing, we'll see a reduction in their turnover next quarter. So with that, I'm going to turn it over to Betsy to talk about the third dashboard.
Thank you. Thank you very much.
Betsy?
I was muted, excuse me.
I know,
Thank
it happens.
It does, and to me a lot. Thank you for the introduction, Ms. Villers, and good evening. It's great to see everyone again, as always. Let's go ahead and jump into our Q2 diversity demographics. I'd like to point out on this page how our organization's racial and ethnic distribution compares to that of Austin proper. The top bar chart represents Austin's demographics, and directly below that, Central Health's own distribution. As you can see, our majority group is technically a minority classification with regard to Austin's own demographics. I'd also like to note that Central Health's overall demographics are examined as of the last day of the quarter, thereby taking both the new hires and termination shown on this page into or out of our organization-wide figures as appropriate. Also, as per usual, we were happy to include the population served demographics within our own organizational figures due to past requests made by our board to do so. So quickly moving on to staff distribution by EEO4 category, there are two changes made from last quarter's presentation that I would like to point out here. The first is a change in the calculation of percentages within the top chart, whereby we now show all percentages as a proportion of each separate EEO4 group, rather than a percentage of Central Health as a whole. We felt that this would provide you with a much more granular and informative view of this data set. The second change is the addition of the second chart down from the top, and so below that which we were just discussing. This particular chart is illustrating the distribution of all minority groups combined versus what would typically be described as the majority group, in other words, individuals who identify as belonging to the white racial group. But again, as mentioned earlier, the white racial classification is not Central Health's majority racial ethnic group within our staff population. The last two charts continue to show the proportion of each racial ethnic group by EEO4 classification as a percentage of the entire count of the individuals within these two different charts, since their numbers are relatively quite small in comparison to the staff population of 202 within this last quarter. And that is all I have for you tonight. So thank you for your continued interest in these figures. And so in conclusion, I will turn it back over to Ms. Villers.
Thank you. Thank you for this very important work. We appreciate it.
Oh, my pleasure, and thank you.
So we'll turn it over to you all for questions or comments.
Okay. Members, do we have any questions or comments at this time? I'm scanning, but if I don't see you, please just speak up. Manager Motwani, I think I see your hand.
Just a comment that I appreciate the work that's happening, and I also appreciate just the additional diagrams that drill down, that clearly show where, maybe more work might need to be done or where it's worthy of examination. I'm always a fan of just, self-guided or self-initiated continuous improvement. And that's clearly where this is, that's clearly the ethic that surrounds this. So thanks.
Thank you. And yes, having the data at this level, and we appreciate it, is very helpful to see if there are areas, as you said, where we can implement that continuous improvement. Absolutely. Members, anything else? Manager Valadez, please. Manager Valadez, There you go.
I want to thank you all as I've been speaking and I'm on mute. Susan, I wanted to thank you and your team for this presentation. One of the asks that I've had in the past is exactly how many employees we have per entity, like per Sendero, per Central Health, and per community care. So I get, the numbers are a context to me. Percentages mean nothing when I don't have numbers. So that's important to me. And also the population that we serve, because the population that we serve is also distinct from the Travis County census population. And I need for our public to also understand that we have to reflect who we're serving. So if you could please provide that information, because I don't think I saw it.
So let me share my screen again with, go ahead, Mike.
And I think Mike
No, I was going to say, if you'd go back to that first graphic, please. Thank you.
Exactly. That's what I thought.
Where I may have missed it. Okay.
Okay.
If I did, I apologize.
All good. No, all good. We're happy to go back. This is
So
important.
this is,
See it now?
this is the population served by race and ethnicity.
I'm sorry. I was asking for numbers. You see, I see percentages.
I see.
And I see percentages and I don't see a number, and I can't relate it to anything, because if I have that information per entity, then a numerical number, then that gives me context, and I have a better understanding of what those statistics mean.
Okay, so let
Maybe
me go.
maybe it's just the way my brain works, but I think I have to have numbers in order to get the statistical significance of them.
If
Right there. Thank you. Perfect.
Right up here.
Yes.
Yeah,
Thank you. I appreciate that. And then also the population that we serve.
Got it.
Right.
Okay.
Well, clearly those numbers can be provided. We had to have them to do the percentages. So I think the only one that you don't have there is the raw numbers on population served. Is that right, Susan?
That's correct.
Yes, and we had to have those to do the statistics. So I'm sure that, Susan, is that something you can provide?
Yes. Yes.
Thank you.
Thank you,
All
Susan.
right. Anyone else?
Good job.
Thank you.
Thank you very much for
Betsy.
your hard work.
Big change.
Thank you very
Good.
much.
Okay, so if there's nothing else, there's no motion necessary on that item. And we thank you, everyone who was involved. I'm sure there were staff who we don't see, so I want to thank you too. We appreciate you even if we cannot see you right now. The next item is item number 8, receive an update from the president and CEO and take appropriate action on a request from Health Alliance for Austin musicians, open paren, ham, close paren. Yes, Mike.
Manager, there's still some more on this agenda item.
Oh, you're right. I forgot. I am so sorry. Lisa Owens is up next for the Hub Vendor Workplace and Hub Vendor Contracting. So we will return to item number 6.
Okay.
Actually, I think we have a recruiting update as well.
That's correct.
Yes,
I'm
we
gonna
do. You're right. We have employee recruitment from Ms. Willers, and then Lisa Owens will do the 2 hub items. I am so sorry. Thank you.
Okay, well, before I share my screen, I want to introduce you all to Sarah Willingham. She is our senior recruiter and provider recruiter at Community Care. She is part of our recruitment team. She does a fantastic job. And she does such a great job that there are 0 vacancies as far as providers are concerned on the community care side. So she's going to kick us off, and then I will continue. So Sarah, let me just pull the presentation up very quickly, and I will turn it over to you.
Thank you. And again, sorry, I think I was so gratified by your presentation. It was moving right along.
Give me 1 second and I'll get there. There you go.
Hi everyone, I'm Sarah Willingham. I'm the senior recruiter with Community Care, and this is my first time seeing all of the board members, so it's a real honor for me to be
Sarah,
here
we
today.
can't hear you.
I can hear Sarah.
Oh, y'all can hear her?
Yes, and Sarah,
Okay, sorry.
Sarah, thank you for being here with us. We really appreciate it. Please continue, Sarah.
Thank you so much. So at the beginning of this fiscal year, the recruitment team and our HR leaders partnered on developing an enterprise recruitment strategic plan. And my colleague Angela, who does all of the recruitment on the Central Health and Sendero side, did share the thesis of the strategic plan at the last board meeting, but I just wanted to reiterate our objectives were to position Central Health, Community Care, and Sendero as an employer of choice by hiring and retaining a qualified and inclusive workforce that reflects the diverse communities that we serve. So as the recruitment team, our strategy has been how to operationalize those goals of the recruitment plan and our strategy. So we had a twofold strategic plan that focused on developing and enhancing the Central Health Enterprise brand by highlighting the enterprise and our ongoing commitment to diversity and inclusion, by continuing to establish a reputation in the community as a great place to work and also to learn and grow as an employee, and also to enhance our organization's status as a quality performer in the healthcare industry. And the second facet of our strategic plan implementation was developing and deepening the pool of candidates and ensuring that that pool of candidates was diverse and qualified. And we are working to accomplish that strategy by developing partnerships within the community, ensuring that the Central Health Enterprise is represented with training programs such as Austin Community College and College of Healthcare Professions, meeting regularly with educational institutes, not only in Austin, but also throughout Central Texas and beyond. And also really partnering with diversity hiring organizations and community-centered career events. And also working to establish a digital footprint that establishes the Central Health Enterprise via LinkedIn, Facebook, and a number of other social media platforms. Next slide, please. So this last quarter two, the recruiters have been very busy at recruitment events. We did attend 19 external career events, and those events did include Lamar University, Austin Community College, Houston Tillotson, the entire UT system, Baylor, Texas A&M, a really great cross-section of educational institutes. We also hosted 4 internal career events. So we did a rapid hiring event for medical assistants that partnered with our nursing and operational leaders. We also hosted a New Year, New Career internal career fair. That was for the entire enterprise. We have partnered with the College of Healthcare Professions on their student job club. And we also did a Spring Into Your New Career internal career fair as well. And we hosted our first quarterly stakeholder call in January. We invited 50 participants, and that did include all of the diversity chambers here in Austin, a number of educational programs and career institutes as well. We had a great turnout for that first call. There were more than 20 community partners that attended, including UT San Antonio, College of Healthcare Professions, ACC, Concordia, St. Edwards, and Texas Tech as well. Next slide, please. And we are also continuing our outreach via social media as well. We average more than 10 LinkedIn postings that target specific openings every month. We also do a number of promos through Handshake, which is the platform that the majority of the Texas educational systems use that directly targets their students and alum as well. And we are also using social media to target key positions as well. And we are partnering with a number of diversity-focused organizations, the Austin LGBT Chamber, Greater Austin Hispanic Chamber, the Austin Asian Chamber, Austin Black Chamber of Commerce, and the City of Austin Economic Development, as well as Workforce Solutions Capital Area. We have been partnering with them through attending events, inviting them to internal events that we host, regular targeted emails and social media posts as well. We also have developed and have been sending out since Q1 an external stakeholder newsletter that focuses on key positions and recruitment updates. We are also putting out a monthly newsletter to the enterprise staff called HR Beat. And the part of this newsletter that really pertains to recruitment is we always focus on key internal career advancement opportunities with that newsletter. Next slide, please. So some key outcomes for us on the recruitment team. Central Health brought on board 14 new employees in Q2. Central Health typically averages 20 vacant positions. Sendero brought on 1 employee. They typically average 2 to 3 vacant positions. On the community care side, we brought on board 129 positions in Q2. We typically average 80 or more open positions. Our next onboarding cycle for 510 actually includes more than 60 new hires coming on board just for next month. And we have also been partnering with our operational and nursing leaders on the staffing for our COVID teams. We brought on board 53 team members in March in PRN status for our immunization scribes. We have also been bringing on board our team members for MAs and MACs who serve our COVID vaccination programs as well. We are bringing on board 40 additional medical administrative clerk positions on the community care side to support the transition to Epic. And on the community care provider recruitment side, this is near and dear to my heart. We just recently brought on board a director of behavioral health who is also a psychiatrist. We have a podiatrist joining our team next month, and we'll be adding an additional endocrinologist next month. So thank you so much for letting me share with you today, and I'd love to turn it back over to Susan.
Thank you. Before you turn it back over to Susan, I just want to say, I cannot believe the list that you just went through. I hope you have help. It's tremendous. Thank you.
I'm just taking a breath now after listing all of those.
I don't know how, yes, please breathe.
Thank you.
Yes, we keep them extremely busy, but they do an amazing job and they work extremely well together. Thank you so much, Sarah.
Thank you.
So last quarter was the first quarter that we introduced to you all the breakdown of applicants. The following slides will provide you with a view of the applicant activity for Q2 of 2021. The numbers you will see on Q4 2020 and Q1 2021 have changed from the last presentation that I shared with you. And that's primarily my fault because I didn't let Betsy do the work on it. So this quarter, Betsy was able to work on it, and so the numbers have changed. We actually realized that the way we were counting the applicants was not necessarily, the previous quarters, was not necessarily reflected on the number of the applicants in that particular quarter, but rather the number of applicants for each position filled within that particular quarter. So that's why the numbers will look different if you compare them to the last presentation. The numbers you will see in this presentation are truly reflective of the number of applicants within the quarter, regardless of which quarter the position was filled. My team and I are still having discussions on how we're going to be counting these applicants in the future. Manager Matwani, you made a request also that we include the number of applicants and breakdown of those that we interview. And we have done some work to try to get that going and so we can report on those numbers. However, our last step in preparing the system to provide that data is to provide a training to our leaders so that they advance the categories within the system. So that's coming, and we're hoping that we're able to provide you all with that information next quarter. So with that, I am going to share with you some of the breakdown. So this is a very busy slide, and I apologize, but I wanted to make sure that in your packet, they're separated page by page, and I just wanted to put them all together so that you could compare them. I'm just gonna hit on a couple of them, specifically the administrative support and professional. So these are, it's the breakdown of applicants just for Central Health by race and ethnicity. And so in the administrative category here, you'll see that we saw a 35% increase in Hispanic applicants and a 2% increase in Asian applicants. There was a slight drop of 8% in the Black or African American section, and a decrease of white applicants by 27%. In the professional category, we had an increase of 10% in the Asian category, a 5% increase in the Black or African American, and a 3% increase of Hispanics with an 18% reduction in the white category. This is a breakdown of gender of the applicants. I'm not going to spend a whole lot of time, but if you all have any questions after you review this in your packet, please let me know. And I'll jump right into the breakdown of the folks that we did hire. And you all got a glimpse of this in the earlier workforce demographic dashboards, but based on this activity on the administrative support category, we hired 1 Black or African American, 2 Hispanic, and 3 whites. In the professional category, we hired 1 Black or African American, 3 Hispanics, and 2 whites. And in the service category, we hired 2 Hispanics, and that is the 14 positions that we hired in the quarter. And with that, I will turn it back over to you, Manager Greenberg.
Thank you so much. These were very comprehensive presentations. Managers, are there any questions before we move to Lisa Owens for her portions? I'm looking. If I don't see your hand and you have one, just speak up. If not, we'll turn to Lisa Owens. Not seeing any. Lisa, do you want to continue?
Sure. I'm back to give you just a high-level update. We did share, I'm going to share my screen real quick to just show you this document you did receive this week. I don't expect you to read it. It's very detailed. But I did want to just hit a few highlights from this update. This is the work plan that we rolled out last summer to expand our outreach in our hub program and to try to collect more data. And so I'm just here this evening to provide a few highlights. We did have some continued success in the outreach, and this will dovetail with the disparity study later this summer, where we will continue this work on an ongoing basis as we develop a formal hub program internally. So first of all, I'd just like to highlight that we've got a great team. Last month, you heard from Belina Bunch, our procurement manager, who presented the FY20 hub report. And we've also been able to add some additional members to our team who are just really making that work so exciting. So we're also working to collect better data. We have data, it's just in a very manual format, as you can imagine, spreadsheets, worksheets, and not automated. So one area, we do use BidSync, as you know, for our formal solicitations, and they have a very robust capture of data that we can report out to you, and we've started reporting some of that data to you. But in informal solicitations, where we are collecting 3 bids or looking at more of an informal process, we are going to be piloting using a BidSync program that has a quick bid feature. And that will give us, again, distribution when we have those quick bids to much broader source of vendors. We use our internal databases and lists, but this has much broader information. And it'll also help us report on statistics, because it will capture how many of those were a small business or minority or woman-owned business. So we're eager to kind of try that out, see if we can bring back better data for you. And then again, continue to work on collecting the data and look at ways that we can automate that so that we have the ability to do more frequent reporting. The other exciting work that's going on in this area is around construction and our outreach. We did host our How to Do Business with Central Health community conversation we've targeted just how to get involved with us, how important it is to get signed up for alerts through either the comptroller's office or through BidSync. And we will be having more targeted presentations now as we are looking forward to the actual construction projects coming together in Hornsby Bend and Dow Valley this summer, and eventually Colony Park. So that outreach will begin to engage specific contractors who may want to bid on this work. And then also we are working with our community engagement team. I know you know them very well. And they have been doing some community engagement and social media around the Disparity Study website. You know, that's an independent website from Colette Holt and Association. And we have started raising awareness about that website so that vendors and really anyone can go to that website and provide feedback, get more information, and also that will help people understand how to do business with Central Health. So we've made some great headway with our team, working in partnership with the real estate group and the community engagement group. I provided a lot more information in written word in that update, and we will continue to implement this work plan going forward. I will be back next month. I think we talked about reporting out on hub expenditures twice a year now. So we've just closed up March. So we'll be back next month to report out on hub expenditures for the first 6 months of the fiscal year. But I'm happy to answer any questions.
Thank you, Lisa. I'm very excited about the study that we have done, the additions to the staff, and look forward to the additional information. Thank you very much. Members, any questions? Yes, Manager Valadez. Manager Valadez, you're on mute.
Thank you, Lisa. I just want to ask if you're working with the people with Susan Willer's group and Miss Worthington's group. I think that's her name, correct? With respect to the reaching out, how they're reaching out to all these various entities for possible applicants to the enterprise, but are we also reaching out to those same groups for dissemination of information with respect to proposals, contract positions, I mean, you know, contract opportunities, et cetera, et cetera? It would seem that that would be, y'all would be working hand in hand. I just want to make sure you are.
Yes, we are working closely with all of Susan's team, not only on recruiting staff, but also how we can get the message out to more diverse work, groups that may want to work with us. And I will continue to make sure that we try to bring back reporting that can demonstrate some of that.
I'm sorry, Lisa, so maybe I didn't make my question clear. I want to make sure that you're sending the information whenever there's RFPs or opportunities for contracting with possible hub partners, whether or not those notices are going to the same entities, let's say like the chambers of commerce, et cetera, et cetera. I want to make sure that that's being done. And yes, you have minority contractors, you have minority, yes. Whatever. I just want to make sure they're included. Oh, that's all.
Yes, my understanding, Lisa, is that in fact that is happening, and perhaps it would be useful to have a list or something that you could provide to.
Yes, we have a standard distribution list, and we can always expand that. So I will definitely make sure that we can get that to you, the different contractors associations, the different chambers, but we will also make sure that we share that list so that you can give us any feedback, or at any time you run into a group that you want us to add to that distribution, please just let us know.
Thank you very much. I appreciate that. You don't have to do that, but thank you.
Thank you, Lisa, and thank you, Manager Valadez. Anyone else? Okay, I am not seeing anyone else at this time. I do not believe. Yes.
If I may, if there's no other board comments or questions, first, and I appreciate the accolades for staff. I too want to join in that. This is, and I've been fortunate to be with different organizations, but this is by far one of the most robust on both fronts, efforts and bodies of work, both on the hub as well as our diversity, equity, and inclusion in our recruiting and our pathways. And what we're showing you today, yes, they look a lot like management tools, but it also starts to tell a story of our culture. And there's a much stronger, more powerful narrative that sits behind this that I think as we work through how we present this to the board, that will certainly bring those stories forward. So thank you for everything that you've done. And thank you to the board for supporting these efforts and the feedback and the insight that you provide as well. Thank you.
Thank you. And that context is very important, and the storytelling and the narrative. So please do bring that forward. And we deeply appreciate all of this hard work. Right. Thank you. If there's nothing else, then we will now move on, because since there was no motion necessary, to item number 8, receive an update from the president and CEO and take appropriate action on a request from Health Alliance for Austin Musicians, open paren, HAM, HAAM, close paren. And Mike Giesen will be presenting.
Yes, thank you, Madam Chair and members. This is an informational and a possible action items. This is being presented to you per motion from the board that was made and adopted or passed by the board at the March meeting. This is not a bylaws or a statutory requirement to act. Again, it's based on board motion. I'm recommending that we continue to collaborate with HAM as the two organizations are very much mission aligned and values aligned. However, I do not recommend that we move forward with entering into the contract as they requested it of the Board of Managers in a public communication session in a prior meeting. The key takeaway points, there is a document in the backup as well as some email communication and the proposal as it was originally submitted by HAM or amended and then resubmitted by HAM. An apples to apples is difficult to do on this, but my approach is that I looked at our current outreach and enrollment and media costs around the Affordable Care Act and then conducted diligence. And I want to commend HAM for being such a great collaborative partner and for budgeting resources to outreach, and especially for musicians of color. If you look at their financials, it's not just about having an organization for the sake of an organization. They do put resources into outreach, and I want to commend them for that. And I think that explains too why we're aligned in mission and in values. The third key takeaway, what's the risk of doing nothing? The RDN, risk of doing nothing, meaning that we don't enter into a contract. Well, we're going to continue to capitalize on this great partnership and reach out to communities of color regardless of musical ability or your membership in a particular organization, making sure that we reach at-risk and marginalized populations. And we're going to continue with our economies of scale. As you've seen in the documents that were provided in the packet, we have significant economies of scale that look a little bit better, but nonetheless, we can continue to capitalize on those and quite frankly, share what we have with HAM and any other affinity group that can help with ACA outreach over the next several months or next few months while the open enrollment extension is still in effect. So to close this, I want to thank, there were many staff and legal counsel and compliance and procurement and subject matter experts that took a look at this and provided me some useful feedback and questions and points of examination and inquiry. And folks came at this with an open mind too. And so I appreciate that. I did have a brief phone call with Renee Collins from HAM yesterday and explained to her what I was going to be presenting to the board and the rationale. And while I think she had hoped for a contract, may be disappointed. Again, I don't want to put words in her mouth. She certainly understood the rationale for it, and both of us committed to continuing to work together for as long as we can, as long as we're all both here. So again, no action is necessary tonight. However, if the majority of board feels like, you want to move forward anyway, then what I do advise is that you consult with legal counsel, compliance, and procurement before doing so. So that concludes my prepared remarks, and I'm happy to answer any questions.
Thank you. Manager Valadez. Mute.
I know it's this computer. I don't know it, and it's anyway. I thank you, Mike. But I will say this to the board and to you: if I had known that we were going to be at this place when we had the previous discussion, and I made a very crude attempt to put forth a motion, I would not have done that. I would have said, I move that we give HAM the $150,000 and that I direct staff to help them work this through. That's what I would have said. I thought that it was clear my intent for having made that motion. I didn't know where it was going to go, but I will tell you this. There is no other entity, there's no other group that is reaching out to the musicians. That means everybody in that world, not just if you play an instrument or sing, but also their families. And there's no one else that knows that like Ham and Sims, both. And they are the ones that are the boots on the ground. They're the ones that are doing the outreach. They're the ones that have the connections that we cannot duplicate with our staff. And we do not have the staff that knows those musicians like Ham and Sims do. Otherwise, we would not have been collaborating with them all these years in achieving what we have had in the past difficulty in achieving, and that is equity or more outreach into the families of color that are in those industries. That's a significant industry in Travis County and in Austin. And so I am prepared to put forth my motion again in this way. I move that we give or enter into a $150,000 contract with HAM for the purpose of reaching out and enrolling musicians, their families, and those within that industry to the ACA program under this extended special enrollment period that has been put forth by Biden. Period. That's my motion. I further comment that with the investments that the Biden administration is making in having local entities understand the significance and the importance of reaching out into communities of color, regardless of what they do and where they're at, for the purpose of enrolling them in ACA and accessing other resources which we can help them access. I think it's important in internalizing that message and in doing what it is we're supposed to do. And that is enroll people who don't have access to resources, that don't have insurance, that need help. That was the industry most impacted by COVID. That is, it remains and continues to be an industry most impacted by COVID. And, you know, I just have to express my concern that we are not duplicating that effort anywhere else. This is not we can't compare what they do to foundation communities. I don't know one person at foundation, any volunteer, first of all, they're not employees, they're volunteers, that gets up off their chair to walk outside and reach out to any person in that industry to bring them to the table and help enroll them. And I know what it is to enroll, and I know how long it takes to enroll. And I know the difficulty in helping them to maneuver and navigate through that system as they look for a plan that is going to accommodate their needs. So
thank you, Manager
without
Valdez.
saying anything else, I make the motion. I'd like to know if anybody'd be willing or brave enough to second it.
Manager Valdez has made a motion, and we certainly appreciate your work in the community, Manager Valdez. I know that you have been out there in the front line, so thank you. Yes, Mike.
I'd like to know if there's a second. Mike, first, I'd like to know if there's a second before we move further.
Don't second, but I do have a question, and so I don't know where.
Bonnie has a question. Okay.
And the question, I'm sorry, it looks like my video is spazzing out, but if you can hear me, I'm just going to keep going.
I completely understand. That happened to me last meeting. So if you need to turn off your video, go ahead.
Brilliant. The question is around if we could just unpack around subpoint number 8 from Mike's recommendation or Mike's guidance. I think before, I could second or even want to really go really deeper into discussing the second and the sort of the cost benefit, the value add, the legal compliance and procurement issues, I think is something I would prefer to unpack a little bit. And I don't know if it's maybe too impromptu to happen right now.
Well, I need to ask a question of David Duncan. Do we need to move into closed session? If we're going to do consultation with the
If the desire is to discuss my legal analysis that was part of Mike's conclusion, then probably so, yes.
Is that your desire, Manager Motwani?
Yes.
Okay, then we're going to have to move into closed session, members. Manager Bell. Manager Bells, let me see what.
Is this before we have a second? I'm just asking. Procedurally, I have a motion on the floor. I'd like to know.
I understand. I understand. Let me see what Mr. Giesel has to say, then we'll get back to Mr. Duncan to see procedurally. Is that okay, Manager Valadez?
Please, yes, Sherry, it is.
Okay, Mike?
Thank you. Well, actually, you just made the second point, which is there's a motion on the floor that for disposal. But second, I do have some items that are responsive to Manager Valdez's, I guess, comments, but I'll defer to the chair as to whether or not to bring those up now or discuss them later.
I'm going to go to David Duncan. David, do we procedurally, what has to happen at this point?
I think parliamentarily you're supposed to seek a second, and that's when deliberation is,
Yeah. So now, if there weren't a second, we could still go into closed session, discuss this, and come out and either have a motion or not, correct?
Correct.
Okay. So, Manager Valadez, yes.
Yes, the only thing I would say with respect to that is if I don't get a second, or if there's a second pending discussion from closed session, then I'll do whatever it takes to get a second. If it means that we're not going to, regardless, then it's a moot point, Sherry. I know how to count.
Okay, so if there's not a second at this point, it sounds to me like procedurally what we need to do is to move into closed session because there are questions that Manager Motwani we know has and potentially others that would be consultation with legal counsel. Is that correct, David Duncan?
Yes, ma'am.
Okay, so let me go to
and I'm not sure whether you want to go in on just this one item or go ahead and go into closed session and then just come out and act on everything that needs to be
we'll go in on all of them. That's what I was looking for. Yes, because there's several. So I am going to read the items that we are going to go into closed session. This item number 8, receive an update from the president and CEO and take appropriate action on requests from Health Alliance for Austin Musicians, open paren, HAAM, ham, close paren. And I'm moving that we go into closed session on that item to discuss agenda on number 8 under Texas Government Code section 551.071, consultation with attorney. Next is item number 7, receive an update from and take appropriate action on a presentation from Sendero Health Plans, Inc., including plan enrollment and final updates. Next is agenda item number 9, and correct me if I missed something, please. Discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in Eastern Travis County. Next is agenda item number 10, receive and discuss an update on the 1115 Medicaid waiver delivery system reform incentive payment, open paren, DSRIP, DSRIP, close paren projects, the Community Care Collaborative and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas. And then item number 11, receive an update on and take appropriate action to approve a consulting contract with Perkins Co. and Guidehouse Inc. for healthcare financial analysis. And so we are taking those items up in closed session, and I have to go back to my item now. So the board is convening. I announced that the board is, in addition to what I read on the previous item, the language, I announced that the board is convening in closed session to discuss agenda item number 7 under Texas Government Code, section 551.085, governing body of certain providers of healthcare services, and section 551.071, consultation with attorney. Agenda item 9 under Texas Government Code, section 551.071, consultation with attorney, and section 551.072, deliberation regarding real property. Agenda item 10 under Texas Government Code 551.071, consultation with attorney, and agenda item 11 under Texas Government Code section 551.071, consultation with attorney. David Duncan, did I miss anything or misstate anything?
Nope, got them all.
Okay, so members, we will need to leave this meeting entirely, and we will need to go to the link that we were given for the closed session, correct, David Duncan? Okay, thank you, members. Is David Duncan?
I see 5 board managers, so we
David,
have.
I assume, do I take these back up in the order in which they were on the agenda?
If there's no action needed, you could just say for the items that there's no action needed, you just you can name the item numbers. You don't actually have to read them all out.
Okay.
You can just say items 8, 9, 10, there's no action.
7.
7? Yeah, 7. Sandera, thank you.
Okay, so we are now out of closed session. It is 9:05, April 28th. We're in closed session on several items. Let's see. Item number 7, there was no need for any action. Item number 9, there was no need for any action. Item number 10, there was no need for any action. Item number 11, does anyone have a motion?
Go ahead and read the caption on that one,
Yes,
if you
I
would.
will.
Ma'am.
Item number 11, nope, I'm getting ahead of myself. Item number 11, receive an update on take appropriate action to approve a consulting contract with Perkins Co. and Guidehouse Inc. for healthcare financial analysis. Manager Bell?
I move that the board approve the execution of a consulting contract with Perkins Co. and Guidehouse Inc. for healthcare analysis.
And Manager
Second.
Valdez?
I second.
So we have a motion by Manager Bell, second by Manager Valdez. All in favor, say aye.
Aye.
Manager Greenberg, can I add one quick thing? It's for an amount not to exceed $285,000.
That's very important. Do we need to restate that, David? David, you're on
I
mute.
believe that the movement could accept that as a
Friendly amendment.
friendly amendment
Charles?
by a non-member.
I accept that as a friendly amendment.
Cynthia?
I accept that as a friendly amendment. Thank
Okay,
you,
all in
Dr.
favor,
Bell.
aye.
Aye.
Opposed, same sign. Okay, anyone abstaining? All right, thank you, members. That motion passed. So that was item number 11. What have I missed here? What item do we have left?
Number 8, I believe.
8, thank you. I'm trying to find it. It was out of order, as you'll recall. Wait a minute. Item number 8. Is there anything on item number 8?
I see Manager Valadez's hand.
Thank you, Dr. Bell. In light of the fact that we're in a pandemic and we have a special enrollment period for enrolling people, residents of Travis County in comprehensive insurance under the ACA, thanks to our President Biden, I'd like to ask that this board approve a $150,000 contract that can be negotiated between Central Health and them for the purposes of.
Read the item. Hold on. I think I have to go back procedurally and read that item. That's item number 8. Receive an update from the president and CEO. Take appropriate action on a request from Health Alliance for Austin Musicians, open paren, HAAM, HAM, close paren. Okay, now.
And Manager Maladez, you had already made your motion. It's still on the floor.
Yeah, it was still on the table.
Yes, the only thing I'm adding is in light of the fact that we are in a pandemic and this is an emergency issue due to the fact that the special enrollment period ends August the 15th. It was supposed to have ended May 15th.
Okay, I don't think that's a motion. You had a motion on the table, right? And that still stands procedurally. Is that right, David Duncan?
Yes.
Okay, so there's a motion on the table that was
Can I
standing.
substitute this? Hello?
The first one never got a second, so yes,
Oh, okay.
actually.
Then I will just make the, in light of the fact that we're in a pandemic, in an emergency situation due to the special enrollment, the ACA, that's the ACA marketplace enrollment, special enrollment period that ends August 15th now. It was to have ended May 15th, which is in just a couple of weeks. I'd like for Essential Health to support the outreach and enrollment efforts of HAAM, the HAM, for this purpose, and that is to outreach and enroll members of color and in their community. I guess, period.
Okay, we have a motion. Okay.
I'm presuming it's dying for lack of a second, Sherry.
Okay.
There is no magic time for that. It's just
No,
it becomes obvious at some point. Okay.
And I
Okay.
appreciate this opportunity for y'all to have allowed me to do this. And I also appreciate the board members for listening to what we had to discuss in an executive session. Thank you all very much.
Thank you.
And I hope that this is a lesson for us to learn as to how important it is to create a calendar and a process for ACA enrollment. And we learned that lesson also for what we do with MAP and MAP Basic.
Thank you, Manager Valadez. David Duncan, did you have something to say? I saw you over there. Nope, you're good. Okay, just making sure. Okay, thank you, Manager Valadez. Thank you, members. I think that concludes the items that we were in closed session regarding, and that should bring us to the end of our agenda, which would be item number 12. Am I correct, David Duncan? Yes. So item number 12, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is scheduled for Wednesday, May 26, 2021 at 5 p.m. or immediately following the Executive Committee meeting at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, yes, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I am ready to accept a motion for adjournment.
Move to adjourn.
I second.
Manager Valadez moves to adjourn, a second by Manager Bell. All in favor say aye. Aye. Opposed, same sign. I don't see any abstaining. Managers, thank you. And I want to applaud the really important discussions that we had and the time that you put into it and the time the staff and the public has put into it. Thank you all for your public service. Really appreciate it. Take care.
Thank you, members. Stay safe and well.